Hi friends, this video is about TNM staging of prostate cancer. The T1 means incidentally found cancer. That is, the doctor during the clinical examination cannot identify the tumor. Then for some other purpose, like suppose the patient had BPH, we have done the TURP, that is transurethral resection of the prostate. We will usually send this for histopathological examination. Now the pathologist will tell that this was a cancer, that is the incidentally found cancer. T2 means confined to the prostate. T3 means minimal periprostate involvement. That is, if the capsule is breached, that is T3A. If the seminal vesicle is involved, that is T3B. So this is a question: in which stage seminal vesicles are involved? That is T3B. T4 means adjacent organs like the bladder are involved. Bladder, rectum are involved. Okay. Now lymph node again N0, N plus, because the remain for N1, N2 they all are same. So it is N0 or N plus, and metastasis is M0 or M1. For the treatment, it is T1, T2 and N0. So we will divide the patient into two categories, category A and B. Category A means the age of the patient is more than 70 years or the life expectancy is less than 10 years and it is a grade 1 or 2 cancer. So the grade is told by the pathologist, that is using the Gleason score. So we have the 1 to 5. So 1 and 2 are usually mild grade. So if all these three are satisfied, then we can do active surveillance. That is, every 6 monthly we will take imaging to assess the progress of the disease. Suppose any of this is not satisfied, like if the patient's age is less than 70 or life expectancy expected is more than 10 years and is a grade 3, 4, 5, okay, any one of this, then we have to do surgery. If the patient is not fit for surgery or not willing to do surgery, then we can go for radiotherapy. Then at any point the lymph node is involved, or it is a T3, T4, that is breach in the capsule, or the seminal vesicles involved, or adjacent structures are involved. Then first we have to do the radiotherapy, then assess for the response. If it is a bad response, we have to do hormonal therapy. Suppose the response was good and it was a category A patient, then again we have to do hormonal therapy. If it is a category B patient, we will do the surgery. The surgery in both the cases is radical prostatectomy. Then coming to the metastasis, metastatic disease, we have to do the hormonal therapy. Remember, all these patients, the poor response wala patient and the category A patient with the good response, they are also having the hormonal therapy. So the hormonal therapy means androgen deprivation therapy. That is, it can be either surgical or it can be chemical. So surgical means bilateral orchidectomy. Chemicals means GnRH antagonists we are giving like begarelix. Then GnRH agonist in a continuous manner like buzarelin. So when we are using the agonist, there will be an initial flare up. So we have to use anti-androgen along with that. That is example bicalutamide. Suppose about 1.5 years the patient will remain stable. Then after that suddenly there will be an increase in PSA, increase in metastasis. Then this is known as CRPC. That is castration resistant prostate cancer. Castration resistant prostate cancer. In this condition, we have to give chemotherapy. Remember, this is the only indication of chemotherapy in prostate cancer, and we will give abiraterone plus docetaxel or cabazitaxel. That is about the TNM staging and treatment of prostate cancer. Hope you understood. Thanks for watching.